So this is going to be the foraminal compression test. So all you're going to do is you're going to interlace your fingers, and you're going to go straight down the patient's cervical spine, feeling if that recreates any of their pain. If it does, it could mean a discal disease. So this is going to be Jackson's test. So for Jackson's test, you're going to laterally flex the patient's head. You're going to flex them forward slightly, and you're going to push down and in, and you're going to extend their head, and you're going to push down, and then go to the other side, laterally flex, flex, push down, extend, and you're feeling to see if you're just trying to see if that recreates the patient's pain. If it does, that could mean that there's some type of IVF encroachment. So this is going to be Sperling's test. So all you're going to do is you're going to laterally flex the patient's head. You're going to apply that overpressure, and then you're going to go to the other side, apply that overpressure. If that recreates their pain, that could mean that there's some type of IVF encroachment or disease. So this is going to be the maximal compression test. So all you're going to do is you're going to laterally flex the patient's head, you're going to extend them, and then you're going to rotate. And then you're going to apply that overload that is right down the articular pillars, and that is going to be checked on both sides. So this one's going to be the cervical decompression test. So all you're going to do is you're going to have one hand holding onto the occiput, the other hand is going to hold onto the chin. You're going to apply 14 pounds of pressure, tractioning that out, and that is going to bring relief, and that could mean that there's an IVF problem. If it doesn't bring relief and it brings more pain, that could mean that it's a soft tissue problem in the neck. So this is a shoulder depression test. All you're going to do is you're going to laterally flex the patient's head passively with one hand, and you're going to decompress with the other one, and it's going to tether that and see if that brings more pain. So Bocote's sign is basically just a sign that a patient is going to present with. If they present holding their hand like this, that is Bocote's sign, and it basically just relieves all the pain in that brachial plexus. So that's Bocote's sign. So for this test, we're going to do Bickel's test. And what you're going to do is you're going to abduct the arm about 30 degrees, then you're going to internally rotate, and you're going to have the patient flex their hand, and then you're going to flex their wrist, and then you're going to have them laterally flex their neck to the opposite side. And that's going to stretch out all that, and it's checking for tethering within that brachial plexus. The next test is going to be Elvie's test. You're going to have the patient bring their arm all the way out to about 90 degrees. You're going to externally rotate their hand. You're going to extend their hand and their wrist. And then you're going to have them laterally flex their neck to the opposite side, checking for the brachial plexus tension. So the next one is going to be the brachial plexus tension test. What you're going to have the patient do is you're going to have them put the back of their hands on the back of their head, and if that radiates pain to the shoulder region, that indicates there is a brachial plexus problem. So the next one is Lermit's sign. For Lermit's sign, all you're going to do is you're going to passively flex the patient's head, and if that brings pain, that means that there could be some type of myelopathy. So the next test is going to be the arm squeeze test. Basically, you're testing to see if there's an actual shoulder problem or if there's like a nerve root problem. So all you're going to do is in the top 1/3 of the arm, you're going to squeeze the arm. If that does recreate their pain, that could mean that there is a problem within the shoulder and not in an actual root. So the next test that we're going to do is the sharp purser test. And basically all you're doing is you're testing for the transverse ligament stability. And all you're going to do is going to put your one hand on the forehead and one hand on the axis, and you're going to push them together, and you're springing through that transverse ligament. If there's a loud thunk, then there could be some instability in there. So for the next test, it's going to be a sign. It's going to be Rust's sign, and basically what it is that the patient is going to present holding their head like it's about to fall off. And basically you're testing to see they're thinking that the transverse ligament has some type of laxity or it has been actually like compromised, so they're going to be holding their head up. That's Rust's sign. All right, so Desjardins triad is basically all you're doing is you're asking the patient if they have a problem or pain when they cough, sneeze, or have a bowel movement.
No.
So next is Valsalva's maneuver, and basically all you're doing is you're having the patient take a deep breath in, and you're gonna have a hold it, and you're gonna bear down like you're about to take poop. Just like that. So the next one is going to be O'Donoghue's maneuver, and you're going to check to see if there's a ligament or if there's an actual like muscle problem. So you're going to rotate their head from side to side, and if it does bring pain, that could mean there's a ligament problem. And then you're going to hold their head. You're going to have them. I'm going to have you rotate to the right against my hands. Okay, good. And rotate the left. Okay, good. And if there's pain on that second one, that could mean that there's a muscle problem.